CISW Virtual Summit 2020. We're now coming to the panel discussion sessions for today. The first panel discussion will be discussing the topic of investment and market opportunities in cannabis and the hemp industry. Now the experts are ready. Please welcome the first panel discussion for today.
Please enjoy. Bye.
So am I on this panel or the next panel?
You are now, Robert.
All right. Cheryl, so lovely to see you again in as many hours.
Hi, good
Hi,
morning.
Cheryl.
Good morning. How are you?
I'm excellent.
This
I've
is
been asked,
Coco.
Hey, Coco.
hello, welcome to this panel of Cannabis and Hemp Law and Regulation Updates. I've been asked to be the leader of the group. I'm not an expert so much as you are, so I would like to share your knowledge with all the people, with all the world. And first, I would like to ask you to introduce yourselves, of course, ladies first. And after that, we will start giving different opinions on different topics. So, Cheryl, it's your turn.
Am I the only lady? Well, it's an honor to be with you. I love what you guys are doing. This is Coco. She sleeps next to me, so I had to bring her, even though we're not loud dogs. But she's pretty chill. Anyway, I'm the CEO and founder of Beverly Hills Cannabis Club, 3-time cancer survivor, and spinal cord injury survivor, walking when they told me I never would. But I'm here to use my knowledge all the way back to 1992, getting started in the industry. And I had a vision that I didn't want cannabis to be dirty or being pushed out into the alley. I'm a proud cannabis consumer. I love what it's done for my health. And I love working with people around the world. And I truly believe that we can heal the world with this plant.
Thank you very much. Okay, let's make it alphabetical order. Andrew, let us know about you.
Well, my name is Andrew. I am from Malta. I'm a pharmacist. I work as a regulatory affairs consultant. What I do, I assist anything in pharma, from factories to obtain licenses, to the registration of medicines, and to the post-marketing surveillance, which we call pharmacovigilance, which will be monitoring the use of the medicines, and when there is an adverse reaction. And my job is to ensure the safety of the products. But I find myself mostly keeping products on the market. What do I mean? It happens that when a new product comes out, of course, there would have been the clinical trials and they would have demonstrated safety. But then 1 in 1 million gets some adverse reaction, right? And therefore it mandates to remove the product off the market. But if we can demonstrate that that was something idiopathic and more people need it, then with hard science and evidence and risk-benefit ratios and real studies, we managed to keep the product on the market so that other people can benefit from it. And this is where I feel I can help heal the world, like Cheryl said, with cannabis, because there are a lot of people that don't want it, but there are many people who have benefited from it. I myself don't use cannabis, but the evidence and the real life stories I have heard and what it's done for many, then it is my moral obligation to ensure that I assist that this product is placed on the market. So this is
thank you very much. Thank you very much. It's going to be a really rich conversation with all of you guys. And Robert Stern, maybe you can tell something about you or what you're doing now.
Hi, good morning. I don't know if I'm supposed to be on this panel, but Albert kindly extended the invitation, and it's an honor to be in the company of these amazing cannabis leaders. My name's Robert Laurie. I'm a lawyer from Canada. It's currently 4 in the morning here on the West Coast. I Let's just see here. Yeah, international lawyer, qualified in England and called to the bar in British Columbia. In 2013, I founded my law practice at Lucem Law Corporation, which I focus exclusively on commercial cannabis, government regulatory, charter, and cannabis issues. And in addition, I'm the senior advisor to an international cannabis company called Theracan International Benchmark Corporation, which again is a full turnkey solutions and critical infrastructure provider for the regulated food, cannabis, and now psychedelic industries. And I agree with the sentiment of my colleagues completely in that cannabis can change the world. It's funny that alcohol and tobacco, if used as directed, will kill you. But the jury is still out on cannabis. So again, an honor to be here and looking forward to this rich dialogue and discussion.
Good, thank you very much, Robert. Okay, now it's Stephen's turn, and we'd like to listen something about you and what you're doing. And afterwards, I will also introduce myself, and we start a relaxed conversation.
Okay, I'll keep it brief so we can get down to some debating. My name's Steve Oliver. I'm co-founder of the Canna Consultants. I like to think of us as sort of legal navigators. So we operate out of the UK. We assist North American companies entering the European space. We specialize in both the supplement market, so CBD, novel food across Europe. We assist with cultivation in sub-Saharan Africa and South America. And we kind of separate this industry into 4 brackets. So recreational, which we don't get involved with. We look at medicinal, and we split medicinal into 2. So cannabis-based products, which, you know, clearly there's going to be a big voice here about the benefits there. Pharmaceutical products. And then we look at the food element. So let's get started.
Cool. Then I just make a short introduction of myself. As you know, I'm Albert, and president of the Federation of Associations of Cannabis Social Clubs in Catalonia. And also I was in the direction board of an association which was closed in 2014. And we have been having 6 trials because of police interventions in either in the social club or also in the cultivations. And in these 6 trials, we had to have 3 acquittals during we were open. And after some years later, in 2018, we had the other 3 trials, which had a result of different convictions. 2 of them we could suspend and change for social works, which we are doing right now. And one of them was more than 2 years, so we couldn't suspend it. And next Wednesday, unfortunately, I will have to go into prison for 5 years. Oh. But at least I've been told that you normally go through half of the conviction, so it's 2.5 years. And hopefully, because of my familiar situation and because of I didn't have any records before, and I could profit of a 3rd grade, which means go only to sleep and and be in the weekend in your own house. So I will go in without knowing what's going to happen, but I feel strong, I feel ready, but my family is not. I have small kids, 6 and 4 years old, so I think I'm worried about them more than for me. But I think we have to go through this to try to change things. And this is giving us loudspeakers to explain the situation, and not only for us, but for a lot of associations, 2,000 in Spain, half of them in Catalonia and mostly in Barcelona, that are suffering from this stigmatization, criminalization. And we want to change this, and we want to also to collaborate in this social global cannabis revolution in a social way, also with the hand of the industry. And I would like also to know about your opinion. How can we share these 2, one really commercial aspect of the industry and the other more social that we are defending? And I think it's compatible. I think both can share the market. And maybe somebody of you want to start explaining how the regulation is in your own country, and how if you visualize a future where this can work in a global level.
Cheryl, I want to jump in on that. Our entire concept was based on being able to consume cannabis. You're talking about cannabis clubs. That's exactly why we formed Beverly Hills Cannabis Club. We believe that cannabis should be as accepted at the dinner table as a glass of wine, as far as people who like to just consume cannabis. But there are so many other things. For example, there's a team of scientists that we're working with right now that's working on solutions for COVID that is bringing in CBD. And that's going to be a very interesting tool now in the US because of what just happened with the presidency. And now that Biden and Kamala Harris are involved, there's a huge opportunity to be able to do clinical trials and so forth and so on. So I believe that in the US, and I think a lot of people follow the US, I think we can continue to focus on the things that cannabis can do and what they can bring to the world. Number one is look at our worldwide economies, look at our worldwide health situation. Cannabis in and of itself, and believe me, growers and people on this side, we are ready. We've got an active activation force that are out there. We're working with the media to get the word out. And I think the more that we can normalize cannabis and show the benefits of it, I think the fastest we can get full legalization around the world. And that's why groups like this are so vitally important. This is a global industry. This is a global effort. And we can do this. We're up and ready and ready to go. And I hope that people will connect with all of us here so we can all jump in. And as I said, you know, when I first started working with Tikkun Olam in Israel, and I asked them what it meant, they said to heal the world. And again, I believe that we can heal the world. Just like the people in this room, there's such synergy and energy, we can do this. And I hope that everyone will join in.
Thank you very much. It was really a good one. Anyone want to talk now? You can ask for with your hand. Yeah.
I'm gonna be slightly different opinion because I think we need to separate the industry, because one of the problems here is it's often referred to alcohol and tobacco undoubtedly bad for you. There's an element of cannabis that can be bad for certain people. We've got to have an honesty here. So if we're talking, we need to separate between food, supplements, we need to separate from medicinal products. And then with medicinal products, we need to be very careful. So we've got pharmaceutical medicinal products, and then we have cannabis-based full plant medicinal products. But we also have people that just like smoking cannabis, okay? And smoking cannabis for enjoyment and recreational purposes is not self-medication, okay? I'm not self-medicating when I have a glass of wine. So I think we've got to be, one of the problems that we have is our ability to actually make change, and from whatever perspective you come from. One of the things we have to do is be honest. And for our message, for the message to permeate, you have to be quite honest in your application. And we have to, I would shy away from saving the world, okay? There are undoubtedly huge benefits with regard to cannabis. There are some very big drawdowns. So I think we have to be clear. So when we're talking about cannabis, I think it's very important to talk about it in its individual component parts. And by that, I mean, what do you mean by, what does cannabis mean to you? So if cannabis means to you, growing cannabis for fibers and from an environmental perspective, that's one particular argument. If cannabis means to you that you like to get stoned, that's it. That's as justified as drinking alcohol. I'm not saying it isn't, but we have to be clear that that's why you like to use it. Self-medication is a very, very gray area.
I'm going to jump in on that. I wanted to make it perfectly clear that I'm a cancer survivor. I use cannabis as a medicine. I just got out of the hospital again after having spinal cord surgery and being in a wheelchair for 9 months. You guys that follow my feed know that. I don't even like the word stoned. I would never use the word stone to identify me. You know, but one thing I wanted to make perfectly clear is once my spinal cord injury started to heal, which I'm still going through, once my cancer was healed, which I'm very grateful, and it's real, it's not fake, it's not a lie, it's not anything. And I've been fighting since 1992. Let me finish. I'm speaking here.
You interrupted me. You interrupted me.
You can interrupt in a second. I'm almost done.
Guys, I'm going to stop you both because
I just don't want to.
Cheryl, you can finish.
I'd like to finish my point was, in the UK, we treat children, and undoubtedly cannabis helps children with epilepsy.
I can answer Cheryl.
The problem is, because there's a conflation of all the interests, we have GPs and doctors who are refusing to prescribe. And I think we are potentially denying people access to medicinal cannabis
Exactly.
problems by allowing the whole thing to be considered as one. I wasn't in any way detracting from your position.
Okay, but one of the things
Cheryl, and
that's
then
most,
Andrew.
one of the most important
Have
things,
to
guys,
speak.
I let you speak. Can I jump in and finish my
Please,
sentence?
I give the word.
You know, what
I
we
give-
have to do is
and then Andrew.
educate people. And one of the main reasons we've got to stay on our path is for clinical trials. I work for biotechnology companies. I work for pharmaceutical companies. Yes, the opportunities are vast, but we cannot pretend that cannabis doesn't have all these viabilities. And when I will continue to say that I believe cannabis can heal the world. Look at the economic situation. Look at what Denver, Colorado was able to do by fixing all of its infrastructure and so forth. I don't think there's anything wrong with looking at the possibilities of taxation or the jobs created. This is cannabis hemp is so effective in so many ways. And when I was saying earlier that I don't think that a friend of mine having a glass of wine or choosing to vape at a meal, I don't think they should go to jail for that. And I'm going to stand by that. And people can criticize me all they want. I don't really care. I'm going to stand for what I believe in. Period.
Cheryl, you are right. You are right.
Now,
And Stephen, you are so right as well. Albert, I'm going to talk now as the health guy here, and then Robert will speak from the legal point, so he can tell us. So I think the disorder is better. Cheryl, like I said, you are a wonderful person, and I know hundreds of people like you, friends of mine also, right? And they told me, Andrew, please help me. I need cannabis. It helps me get out of bed in the morning without I'm in a lot of pain. I have a prescription for this opiate medication, and I'm dizzy all day. I can't even go to work. I don't know what I'm doing. And when I take the cannabis, it gives me the same relief, but not the side effects. And I'm like, of course, you're right, you know. So then we get to good doctor, you know, and the doctor says, no, cannabis is illegal. I'm not going to prescribe it, and they stay away from it. So you see, it's the legal status and the stigma the product has that is causing problems right now. Now, to elaborate on what Stephen said, because Stephen is so right. The thing is this: in this industry, we need to safeguard the world. Meaning, if cannabis is made freely available, I mean, what's going to stop it from kids, you know, getting high? I mean, you see them, man, in the street, you know, smoking, getting high, and selling it, you know, on back doors, you know. I mean,
that's horrible. That's horrible. And yes, that's why we need to legalize and educate.
How do you control it? You see, this is how do you control it? You know, listen, I want to give you the cannabis, and so does Stephen, right? But at the same time, the government wants to protect those who can be harmed, and this is where we are. So Robert maybe can share some legal knowledge to see how, you know, we can legalize and make it available. Like I said, the pharma industry has a moral obligation to make this available. Okay, you as a patient, as a cancer survivor, are an ambassador for the product. You are an ambassador, right? And you say yourself, you don't like to get high. I mean, I myself, I like to have a drink, and sometimes I like to have a few shots as well and get a bit drunk, but I'm in control. And then I don't drive, I get someone to drive for me, right? I'm responsible. But other people, how many accidents do we hear of people, you know, that took one glass too many and then had a bad accident, or were still killed someone else, you know? I mean,
I think you're focusing, sir, on the wrong things. You know, let's take a look at what's really happening. It's just like with alcohol or anything else. You use responsibly with medication. You take as directed. With children and pharmaceuticals, you make sure that their children's safe. You know, if you have pharmaceuticals in the house, put them in safe so children can't get them.
So
but you have to have education and you have to have laws in place.
Laws, exactly. In this case, the industry from the pharma side, and in Malta, we made cannabis legal for medicinal purpose only, available on controlled substance prescription. However, this has caused a lot of problems. It's expensive. It's expensive. Expensive to the point that it's not really affordable for everyone. So, you know, we're torn between two sides here. Like I said, we want to make it available, Cheryl. And
Well,
Stephen.
but I don't. There's things, guys. There's things going on behind the scenes here that no one knows about. And people say, "What about big pharma? What about big tobacco? What about big this and that?" Big pharma, big tobacco, big alcohol has been in this industry already for decades. I've signed NDAs, so I can't tell you exactly who they are, but all these people are waiting for a position. Why? And why hasn't cannabis been legalized up until this point? Here's a news shock, everyone. Cannabis was legal around the world for thousands of years and used thousands of years until prohibition came in. And then they came in and tried to hold people of color down. And I understand I've worked with pharmaceutical companies, biotechnology companies. The only reason that you can't get it legally now is they can't make the money on it. And let's talk about the real devil in the room. Let's talk about opioid addiction. Let's talk about how doctors are so easy to write a prescription for opioids. Opioid addicts are the people that are causing problems. How did they do it? Because the doctors gave them the prescription. And cannabis can actually be an exit drug. There are studies that show that cannabis can be an exit drug off of opioid addiction. And that's something we need to talk about.
Andrew, wait a moment, please. Andrew.
Become legal as like tobacco is. What would you think?
Please. Yeah, we would like to hear also Robert, that he didn't have the chance to talk.
I'll say one more thing, because Cheryl, you are right, and I'm on board with this. Okay, because we're forgetting something, what we call interpatient variation, right?
Yeah, Andrew, please, can we listen?
When I drink, I'm okay. I don't get high. I don't get drunk. And you yourself, you don't like to get high, you said. But unfortunately, these things mess with our brains in different ways.
Yeah,
very different ways. For example, a friend of mine, if she drinks 2 glasses of wine, she goes mad. She starts taking off her clothes in public. Messed up.
Okay.
Now,
what's her phone number?
We want to listen to Robert now. Let's listen to Robert, please.
So,
come on, Robert.
We have to say about these people, and they are mature, responsible people.
Andrew, please.
1 glass of wine, we do this to her brain.
Andrew, please, relax.
All right, guys, I'm gonna have to leave you. Lovely speaking to you. Let's work together to make cannabis available to everyone. That's why we're here.
Listen to Robert, please.
But to point out the problems and
let's listen to Robert, please. Let's listen to Robert.
All right, I better jump in here. The problem that I see it is this. We have very comprehensive food and drug regulation. Each country has drug and food regulation. Cannabis and any of these other restricted drugs, and we can include this, the common psychedelics, but for very poor international regulation and law that may have had a purpose 95 years ago in the case of cannabis, and nearly 45 years ago in the case of some of these psychedelics, but for the agendas of international conglomerations and big countries like the United States, they've scheduled all of these substances. Canada being the first G7 country to legalize on a federal level, we still have these problems because before cannabis became legalized, it was effectively a medical product that had been argued in court for over 18 years. And so the problem is there's still prohibition era drug and stigma over simple choices that I consider regarding the integrity of my body and my right to consume medicine and access medicine that is a benefit. And so I do find it, again, very presumptuous by governments who claim to be able to speak for what's best and right for my body and my health when they don't even understand the issue. And while doctors as gatekeepers in Canada, they have been relegated into that position by the courts. And unfortunately, doctors can only make the decisions based on the knowledge, training, and experience that they've acquired while at medical school. So there's clearly gaps between what they should know, what they know, and what they need to know. And that leads into another, and I'll just end my point on this, is no one's really talked about the freedom of consciousness. If I wish to use cannabis or any other entheogenic medicine to realize there's a God or life force or a feeling of unity with the universe, if that's going to make me a better person and that being done in a therapeutic situation under the guidance of caregivers, whether they be a psychedelic therapist or an MD, we need to explore these, because ultimately no government or member of the clergy or church should say, you shouldn't use these substances, or you shouldn't have any meaningful relationship with something that actually throughout history, as Cheryl and Albert and Stephen, we all agree that these medicines have played a part in history. It's just, how do we now proceed with international, federal, provincial, state, and municipal laws, which again, banking, accounting, and compliance, they all take their cue from the international laws and the UN convention. So that's ultimately, I think, where we're going to have to adjust in order to be able to explore all of the possibilities which all of the wonderful panelists on this panel are proposing. So I hope that maybe gives a little clarity as to my perspectives. But again, it's just my perspective. We have to consider everybody.
Okay, thank you very much, Robert. Stephanie, yes.
Albert.
Again, I think we just need to separate it out. Hang on a second.
Something else, but I just have 1 minute.
Sorry, Andrew.
Andrew.
We have 15 minutes left, okay? So we're going to talk, all of us, one more time at least. And I'm supposed to coordinate the words. So, Andrew, we're going to listen to Stephen now.
Okay, Stephen.
I don't disagree with anything that any of the panelists are saying, but I come back to the point, and I think it's borne out by this conversation, that there are, you know, we all have different passions and different agendas. And I'm an advocate for regulation because I don't believe in legalization. And I don't think legalization solves this issue. I don't think it should be criminalized for cannabis use, and I don't think alcohol should be lawful, but that's a different conversation. But I think you need tight regulation around medicine. And I think medicine, cannabis, education, and the access for patients, bless you, should be there.
Thank you.
And I think we've got a huge way to go. You know, we had 100 years where we've got something like 100,000 papers on the danger of tobacco, and we had 5,000 academic papers on cannabis. So we need to turn that around, and we need to educate GPs. But I don't think we achieve that by running a legalized cannabis campaign alongside it. So from my part, I like to part legalization, and I like to concentrate on the access to patients for medicinal cannabis and research there. And then I like to decompartmentalize the other, which is that at much lower dosage and in isolation, there is also the use for CBD isolates and for people to supplement their lifestyle and their food with cannabinoids. But controlled cannabinoids have to be dealt with, and they have to be ring-fenced in order for us to win those arguments, I believe. So in order for you, Cheryl, to be able to receive the medicine that you have, I have no doubt you've had this situation happen 20 years ago, we'd all be using Rick Simpson oil. Thanks to pioneers like that, we now have a situation where we do have medicines. But I think if we allow everything to come and mold into one, you can have these arguments and they can be hijacked by people who are looking for legalization. I pass no comment on people's right to smoke marijuana. What I do think is that it can have a detrimental effect to people who are looking to further the medicinal use and research in that area.
I'm going to jump in on that. Here's the issue. The funny thing is we're not actually disagreeing, just so you know. I think there's a miscommunication. For me, what people, you can't really take cannabis or hemp and put it in one corner. There are hundreds of endocannabinoids in cannabis itself. How many different uses are there for it? That's what we need to look into. Let's talk about the legalization or whatever you want to call it to make cannabis available. For example, I'm going to give you an example how the laws are so messed up here. States like Colorado have made tremendous wealth and tremendous impact on getting things done. And yet in the United States, in Texas at that time when this happened, there was a teenager in high school who had a grandma who was dying of cancer, and he made her a pan of cannabis infused brownies, which really helped her. But then the child, who was almost 18, got arrested. Someone at school turned him in, and he was facing 15 years to life for making brownies for his grandmother. I'm sorry, that's wrong. When the next 2 states up are able to make millions, if not billions of dollars. So the laws have to be changed. Maybe I should say that. Laws need to be changed. And there's going to be different laws. There's the pharmaceutical people, there's hemp people and all the different uses for that. There's so many different things, but what we need to do is get the dialogue going. We need to get clinical trials. We need to do a number of things. But one thing I don't believe is that people should be serving 15 years of life in prison for brownie.
I agree. The grandmother should be able to access the brownie or in a much more accurate dose format and a medicine from the chemist. And the law should remain in place so that somebody doesn't make the brownie for recreational use, if that's what people decide. And as you've seen in America recently, you have a democratic process. In the UK, we have no recreational use. You know, there's a little bit of lack of enforcement. Yeah, would it be better if it was legalized? I actually don't know. But what I do know is it wouldn't be better for medicinal patients, I don't think. But
Guys,
the sad thing is we don't know yet because we don't have the laws to be able to do the clinical trials.
Stephen, Robert, Albert, real pleasure, guys, real pleasure. Keep working on what you're doing. Let's see how to change the world collectively, all right? Don't fight. You're saying
it's not a fight. It's not a fight. I'm just...
I'm going to add very quickly about the brownie story, and that's a beautiful story. But you know what happened? I mean, in the past, my grandmother was one of the first pharmacists in Malta, one of the first, back in just after World War II. And yes, I mean, the doctor would write a prescription for example, a cough medicine, right? And she'd have a jar of cocaine in the back, big jar, like 5 kilos, whatever, cocaine and heroin, and they'd make mix the powder, she'd weigh them out, put some heroin, some cocaine, together, and make it in a tincture, some alcohol, and they would make this cough medicine, right? Very legal. No one was getting high with this stuff. But when people started abusing it, when drug dealers noticed that it has an effect on some people and messes with their brain, and they could get them addicted to it and hooked on it, that is when problems started. A controlled substance, and when we found alternatives for it, it became an illegal drug. Nevertheless, the word drug means is a medicine, right? So this is what we do. We need to be careful that the grandson that gave his grandmother the brownies, right, was good, that someone else, unscrupulous, does not copy the idea and then start selling brownies to people that might be affected differently, and create a situation where he is hooking people on it and ruining lives. So this is what we need to keep in mind. Anyway, bye guys. Take care, and I hope we speak again. All right.
Okay. So you I guess you have to go, or you have to say goodbye.
No, I have another meeting now, okay, with the government actually. Yeah. With the government.
We have 8 minutes left here. So
they're waiting for me. Goodbye. Bye-bye.
Okay, goodbye. We have 8 minutes left. I've been told, and I'd like to say thank you to you and give you a last word. I didn't know this was a panel to discuss recreational against medical use debate, but anyway, that was how it was. And I'd like to know your opinion how to finish with this war on drugs, which I think it's a war on the people, not only on drugs. Maybe the United States, who started with this provision, should push more for the international legalization. I think it's always better to regulate than leave the black market to do what they want. And always with regulation, you can protect minors, you can protect mental illness, you can protect a lot of things, and also get all the benefits for society, like job creation, economic activity, and also taxes, a lot of things that can help investigation and other ways to help the medical use. So I'd like to maybe give you a last word to finish and ask you if the industry can also help the people who need help, like me, who will enter prison in next week. Thank you.
Guys, I wanted to make sure that, does everyone understand the AIDS epidemic and everything that we started doing in 1992? Nothing was legal at that point. And what happened was the AIDS epidemic, just like the COVID epidemic, was killing thousands and thousands and thousands of people every single day. That's when I started working with cannabis, working for AIDS patients, when we knew that it was helping them to give them a better quality of life. It didn't save their lives, but that was like an emergency referendum when they legalized for Prop 215 in California, all the way back in 1996. You know, so that was illegal, but it had to be done. Sometimes laws have to be broken to get things done.
That's what I'm doing right now.
I know, that's what I'm saying. We're actually on the same team. It's just,
yeah, of course.
you know, I have to make sure people understand.
Yeah.
Okay, I'll give you my very quick story then. So my first, obviously, I'm in my 50s now, so I have it, you know, I understand how cannabis works. I came into the CBD from the supplement route about 8 years ago before my mother passed away, and she had very aggressive Alzheimer's. And I sought actively to find, because I couldn't in the UK then, from Holland, CBD oils. And what I established very quickly was that it really, really helped her with the terrors. But what I also found was that the industry was 90% cowboys who were looking to exploit people. So I'm a big advocate. I'm a big, big advocate for regulation and for laws surrounding any form of medicinal product, because otherwise unscrupulous people will take advantage.
Exactly.
The war on drugs has failed. You know, I worked as an investigator, a DEA equivalent in the UK in the late 80s and the 90s. I worked undercover against drugs teams. It does not work. The people that are caught and penalized are the people making the brownies. The people making the money are very rarely caught. It has failed. Nobody disagrees with that. But I think the war on drugs should not turn into a war on medicinal cannabis. And I just think they're two different debates. I think what's happened to you is terrible, and I wish you well, and I wish your family well, and we should keep in touch.
Thank you very much. And maybe we have some minutes left. Cheryl, I would like to congratulate you for all your work and all your life. And maybe when I go out of prison, I can go and visit your cannabis social club. I'll be delighted. And let me know about the experience of social clubs in the States, because I've heard a lot about the dispensaries, but not so much about social clubs.
Well, that's the thing. There really aren't any at this point. We have the only real social club or cannabis club that there is. And that started primarily because when I was working in the AIDS community, you know, I work with a lot of celebrities. I've worked in film and television since I was 17 years old. And celebrities, even, well, at that point, were terrified about coming out of the grass closet, right? However, once they start, and I would tell them, I'm like, you're a hypocrite. You use cannabis. Don't you understand that as a celebrity, as a public figure, you could help change the laws? And that's why, you know, when I started in 1992, no one was talking about cannabis. The only way you could see cannabis on the news was if someone was blowing their house up with butane extractions or overdosing on opioids, and they go back to, well, he smoked cannabis first. Pardon my language, bullshit. That's just wrong, you know? And again, we have to understand what cannabis does and what these other drugs are doing. But I'm telling you, we need to legalize this because people who are patients like me, or an AIDS patient, or someone that has cancer, they should have access to cannabis. There's a difference between, I hate the word recreational cannabis. I just don't, because it's just like alcohol. Use it responsibly. Use it as directed, just as you would medicine. Put your cannabis in a safe or somewhere where your kids can't get it in the house. But that doesn't mean just because you're a cannabis consumer, you're out peddling pot and other drugs on the streets. I've never done another drug in my life. I don't have a desire to. I never have. I don't really drink alcohol, but cannabis helps me with my back pain. I just had back surgery, you know, and I don't think that I should have to worry about looking behind my back and getting arrested.
Thank you very much, Cheryl. Do you want to add something, Stephen?
No, I'm fine. I think I'll leave the last voice to Cheryl and yourself.
Yeah, okay.
Well, one thing I would like to see is the gentleman who's going to prison. You've got to let the community know. You've got to let the news people know what's happening and how this shouldn't have happened. You should do this before you go into jail because you'll get out. But meanwhile, while you're in, people like me will pick up your cause and I'll fight for you. I'll fight for you and I'll fight for everyone else that needs help in getting attention drawn to their particular cause in their particular state or country or whatever else.
Thank you very much. We're in this point, so a lot of years we are doing this. We have a campaign called Consumption with Rights. We have the two federation of associations are working together in the whole Spain and Catalonia, and we have a lot of advocacy work with politicians, also with the media, and now we have to spread out of the country to make it international. So this is where we have a crowdfunding to help us pay all the lawyers. We have signatures.
Call me. I will help you. Call me. I will
okay,
help you.
I will. I think we have to finish it here. Thank you very much for your collaboration and for the way you are. I love you, and I also think we can save the world a bit, just a bit. Thank you very much.
Thank you.
Bye, everyone.
Bye-bye.
Bye.